Hello and welcome. I'm here at Spire Cardiff Hospital to talk with Innermost Secrets to find out more about the services that they offer to pregnant and non-pregnant women and what makes them unique with their service.
Hello.
Today I'm meeting with Dr. Bryan Beattie, the Director of Innermost Secrets. Thank you for taking the time to meet with me, Bryan. Tell me, what are the range of services that you offer here?
Well, originally whenever we started, it was really providing ultrasound and medical care for pregnant women, and we very quickly realised that a number of women had suffered huge problems prior to becoming pregnant. Either they had difficulty in conceiving, or perhaps had been fortunate enough to conceive but had lost pregnancies early on. And so it seemed a natural progression then that, as well as helping to support women through pregnancies, we should also concentrate on supporting women who are trying to conceive, and in those who are pregnant and trying to support them through the pregnancy, or for those who have lost a baby to try and find out why and see if we could maybe get a better outcome in their next pregnancy.
So why did you set up the consortium? What makes you different?
Because various aspects of medicine have become so specialised, it became very clear that it was important that we had people who were specialists with an interest in particular fields within obstetrics and gynaecology in order to deliver the very best level of care. So, for instance, we have experts in fertility, in sexual health, in obstetrics and in maternal medicine, that is looking after women who have significant medical problems in order to support them through the pregnancy. And it's not possible for any one individual to be able to do that well.
What's your approach to delivering that care?
Well, I think there are three important aspects. I think one is information, so that people are in a position to know what their options are and to make informed choices. I think the second thing is to provide high quality medical care. And I think the third thing, which is just as important, is to provide support, because a lot of people who are going through problems trying to conceive, having lost a pregnancy, or even going through a pregnancy, are extremely stressed and have a lot of anxiety associated with what's going on in their lives, and therefore it's just as important to provide that support as it is to provide the actual medical care.
I think that level of care is definitely what makes Innermost Secrets different. But you have a lot of doctors working here. How do you bring them all together?
Well, this was a huge challenge whenever we set up the consortium, and we're very fortunate in that there is a company who have developed software called Viewpoint, which really is at the key of what we do. And what that will do is it would allow the staff in the office to identify who the patients are, what treatments or what investigations they're having. It will allow the clinicians to see the background information whenever they meet the patient for the first time. It allows multiple input from various people, so often they will have 3 or 4 specialists maybe looking after the one patient. And that whole record is then put together so that the clinicians looking after the patients can do so with the full knowledge of all of the things that have been happening to that individual.
And so reducing human error.
Yeah. Well, the other big aspect is from the ultrasound point of view, it's well recognised that when you start to write out handwritten reports, that transcription errors occur, and that's very important when you're tracking, say, the growth of the baby or how well the blood is flowing through the placenta in a high-risk pregnancy. And the system will also allow us then to pull those details from the ultrasound machine onto the computer, so it completely cuts out the chance of any human error, which is a common problem in most other hospitals.
So personally, Bryan, what do you get out of what you do here?
I must say I love the job that I do here. It's very satisfying to be able to support somebody who's maybe had difficulty in conceiving or has had previous early pregnancy losses, to be able to see them right the way through the pregnancy and then coming back 6 weeks after the baby's born for their postnatal check with the baby on their knee. And that, for me, is what it's all about.